for joining today's press conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Hello, friends. I'm joined by Melissa DeRosa, Robert Mahica, Commissioner Zucker, Beth Garvey, and Gareth Rhodes. I'm going to give you an update on today. First of all, let me make some comments about the sadness and disgrace in Washington. People say, well, President Trump started it yesterday. I disagree. President Trump didn't start it yesterday. President Trump started this 4 years ago. When you spread hatred and distrust and division, don't be surprised at the ugliness. This is 4 years of placing wedges in every crack in society. This is building walls. This is putting children in cages. This is speaking poorly of the Muslim community. This is saying at a KKK march there are good people on both sides of the argument. This is 4 years of appealing to the worst in human instinct and preying on people's fears. And that's what yesterday was. The story ends the way the story began. They talk about reaching out to better angels. This is a man who has spent 4 years touching the darker side of humanity, exploiting fear of people who are different, preying on insecurity. That's what yesterday was. There was an explosion of hate that he created over 4 years. That's his legacy. That is his legacy. Yes, when you, as President of the United States, with that large microphone, tell people to be frightened of other people, tell them to be violent, speak about carnage, arm yourself, defend yourself. Don't be surprised at the anger and the hell that you have rallied. That was him. That's his legacy. And even his great conservative allies now turn on him, because it was a universal disgrace and embarrassment for all Americans. And it was a disgrace. Talk about making America great again. He made a mockery of America for the entire world to see. Party of law and order. And then he couldn't stop thugs from breaking windows and climbing in and vandalizing the nation's capital. Party of law and order. Law and order. And for hours on TV, they couldn't even stop a crowd of thugs from breaking in to the Capitol. Think about the great irony. I stand with the police. It went on for hours. The party of law and order. Anyway, in some ways, I think it brings the story to a full and fitting climax. The American people reject hate, reject violence, reject division. And they do it now with one clear voice. And that's what he accomplished. Universal condemnation, which is what he deserved. Some update on today. We had a number of discussions with local governments around the state on the vaccine. We are very worried about the quote-unquote UK strain. We still have only the one case confirmed here in New York, but we believe there are more. The CDC announced something like 50 cases across the country. We believe we have more. It's very hard to test for the virus. But at the UK, for that strain of the virus, in the UK it overtook everything in 3 weeks. Local governments, as well as I, am very concerned about their local hospital capacity. We are continuing to see an increase in the hospitalization rate, and the red line is overwhelming the hospital system. That's where California is. That's where other states are. If the UK spread catches on in New York, the hospitalization rate goes up, the hospital staff is sick, then we have a real problem. And then we're at shutdown again. The hospitals, the primary problem in hospital capacity now is staff shortage. We have increased beds. We have equipment. It's not the problem we had in the spring. But the problem all hospitals are reporting are staff shortage, primarily nurses. And that's why we reinforced the necessity to get the hospital healthcare workers vaccinated. You know, in the airline, when the announcement comes on, when you're sitting on the plane, in the event the oxygen mask falls from the compartment, first put the oxygen mask on yourself and then put it on your child. The equivalent here is protect your healthcare system, keep your hospitals open, so if you need them, there is a bed and a staff to assist you. The prioritization of healthcare, 1A, is federal guidance, is state guidance, and it's virtually universal across the country. We have mixed performance by hospitals across the state in doing the hospital workers. We have some hospitals that are still lagging, and we have some hospitals that are doing much, much better. I think they heard me on Monday when I said they had to get the vaccines in the arms by Friday. We have seen a dramatic increase in their performance. They were doing statewide about 10,000 vaccinations per day for the first several weeks. On Monday, that number went to 30,000. Tuesday, it was a little over 30. Wednesday, the number went to 50,000. And today, we're going to be in excess of 50,000. That's 5 times the rate they were doing. Tomorrow, if they haven't used their allocation, we will reallocate the allocation, and we'll talk about how we're reallocating it tomorrow. In total, we have 2 million healthcare workers in the state. In total, we only have 900,000 doses for the 2 million. So statewide, we don't even have enough vaccines for half the number of healthcare workers. That's why I've been saying any hospital that has reached their refusal rate refusal rate means I've offered it to everyone, and the ones who want to take it, and the ones who don't want to take it, don't take it. The refusal rate varies depending on the hospital, depending on the workforce. Doctors are taking the vaccine at a much higher rate. This is anecdotal, but I would expect to see numbers in the 80 percentile for doctors. And doctors know best. Nurses, there's a variation among nurses, but I would expect to see that a low of 70, a high of 80. 70 is the minimum threshold for viability of the vaccination program, right? The vaccination program, to hit herd immunity, you have to be between 70 and 90%. If we're under 70 overall, then the vaccination program is not as effective because you don't hit herd immunity. We would hope that we're higher than 70 with the healthcare community because they're most educated and most informed. But refusal rate, say it's 70%, is acceptance, 30% refusal. Any hospital that hits their refusal rate, I offered it to everybody, nobody else wants it. Fine. Tell me, we'll reallocate it, because again, overall, we don't have enough dosages for half of the population of healthcare workers. And we want to get them vaccinated. We owe it to them ethically, frontline heroes, everybody celebrates them. Well, let's actually not just celebrate them rhetorically, but let's, in reality, give them the vaccine. Also, if they get sick, the hospitals are going to close. It's that simple. After 1A, we will go to 1B. 1B are essential workers and 75-year-old plus. Essential workers, police, fire, teachers, public safety, and 75 plus. 1B is over 3 million people. Again, we're getting 300,000 dosages per week. So the supply is our issue. 1B, the distribution mechanism is going to be different. 1B, we're going to use thousands of points of distribution across the state. Pharmacies, doctors' offices, what's called FQHCs, community groups that are going to be making special efforts in our Black and Latino communities and poor communities across the state. So those areas will be served across the state with thousands of points under 1B. They will not primarily be distributed by governments. In 1B, for large groups like police, firefighters, etc., we said to the local officials today, to the extent a police force or the firefighters or the teachers or the transit workers can self-administer, that would be great. In other words, police has EMS, EMT, firefighters have EMS, EMT, transit workers have their own health network. A lot of the large unions have their own health network. To the extent we can just give them the vaccine and they can self-administer, great. And that frees up the pharmacies and the doctors to do the 75 plus. But it's not going to be a distribution problem because we'll have thousands of distributors under 1B. It's going to be a supply problem. Again, right now, we have 2 million healthcare workers with 900,000 doses in hand. 1B will be 3 million people. and we're getting 300,000 a week. So you see why the supply is going to much lag behind the distribution. On the overall distribution, high performers. Oh, this is hospitals. 1A is hospitals distributing, not local governments. And the reasons the hospitals are distributing is because they're healthcare workers in 1A. That's why we used hospitals. 1B is general public and essential workers. That's why we're using private facilities also. High performers, NYU Langone, Tisch Center. It's a very long name, 100%. Oswego, 100%. Richmond, 100%. St. Barnabas, 100%. SUNY Downstate, 100%. Congratulations, Jim Malatras. New York Presbyterian Hospital, 100%. Cayuga Medical Center, 100%. SUNY Upstate, congratulations, Jim Malatras, 100%. Kaleida Buffalo, 98%. Adirondack Medical Center, 98%. On the low end, Montefiore, 17. Clifton Springs Hospital and Clinic, 18. Brookdale, 22. A.O. Fox Hospital, Tri-Town Campus, 22. Calvary Hospital, 27. Olean General Hospital, 28. New York City Health and Hospital, Queens, 29. New York City Health and Hospital, Coney Island, 34. New York City overall, and these numbers, by the way, are from their own submissions. There's no argument about numbers because the numbers are sent in under penalty of perjury. But New York City overall has 917,000 eligible healthcare workers in 1A. New York City has done 144,000 of those 144,000 vaccines. 917,000 eligible healthcare workers, 144,000 vaccines. That's roughly 14% of the healthcare population. Even if you want to say the city says their refusal rate is 30%, that means the acceptance rate is 70%. But they've only done 14%. That's the problem with New York City. And I discussed that with local governments also today. We have to get the healthcare workers immunized. That's federal guidance, it's state's guidance. If you hit the refusal rate, fine. But New York City, you vaccinated 14%. How can you say you hit the refusal rate? What you say is 30%. It's a long way from 14 to 70. And we don't have enough, again, we don't have enough vaccine. We're only at 900,000 doses against 2 million healthcare workers. So anybody who hits the refusal rate, tell us, and we'll reallocate. When we go to 1B, some local governments said they want to prioritize police. They can't do that. The first, some local governments have said, well, police are healthcare workers because police give CPR. First of all, this plan has been out there for months. It's clearly said 1A are healthcare workers, 1B are essential workers like police. Every police officer is trained to do CPR. That doesn't make every police officer a healthcare worker. That's just silly. And when we get to 1B, no local government can prioritize one group over the other. You can't prioritize police over firefighters. You can't prioritize police over teachers. And you can't prioritize police over 75-year-old New Yorkers who have the highest death rate in the state. It is one group, and they're going to be treated fairly. And I'm not going to pick police over teachers, over firefighters, over grandpa and grandma and mom, in my case, at 75 plus. That just will not be allowed, period. But the hospitals have made good progress. They're doing fivefold what they were. So I'm glad they heard me. Tomorrow we'll announce a reallocation plan. We have to get the healthcare workers done. And with that, let me stop there, and I will take your questions.
To ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound or hash key. Please stand by while we compile the Q&A roster. First question, we have Keisha Kuki from Bloomberg. Your line is open.
Thank you. Hi, Governor.
How are you?
Good, thanks. How are you doing?
Good.
2 quick questions for you. One, do you have the total number of people who have been vaccinated statewide to date? And then also, why reallocate the vaccination rather than getting it in other arms that are nearby? It seems like a very complicated process to ship this.
Well, first, it's not that difficult to ship, but we're going to announce a reallocation plan tomorrow. Right now, we have had no hospital who has told us that they are at their refusal rate. Okay? Again, pick a refusal rate, 30%, et cetera. But your basic point is right. Reallocation can be we're going to send healthcare workers from the next town to come to your hospital to receive vaccines. We're going to send you, can you please go to this hospital and help vaccinate their workers? I am deluged with workers, healthcare workers, who are upset that they haven't gotten the vaccine. Now, again, I only have 900,000 doses statewide for 2 million healthcare workers. But we're not at 50% of the healthcare workers. So depending on the hospital, depending on where they are, we can come up with a specific way to actually, quote-unquote, reallocate. Doesn't mean we'll ship it from one hospital to another, but we do want to get those vaccines in the arms of healthcare workers. Total vaccines to date is about 430. Melissa has a point.
Yes, and just to punctuate what the governor is saying, again, the 1A category is not limited to people who work in hospitals. The 1A category is much broader than people who just work in hospitals, and as of Monday, the 1A category expanded dramatically. The point of doing the prioritization, which we did in following federal guidelines, is that you want certain people to have priority at the very beginning. They're the ones that interact with people who are sick. They're the ones that interact with people who are elderly. They're the ones who, if not vaccinated first, have the ability to spread it to people who have weakened immune systems. And so the issue with just skipping onto 1B is that you're then saying that 1A is no longer given priority. As the governor said, 1B is massive. Everyone over 75, it's teachers, it's firefighters, it's police. And so what ends up happening is the people who are in 1A, if they don't get it while they're still priority, they go into the mix, they could go to the back of the line. The question is, are you inadvertently punishing people who are in 1A, not because they don't want to get it, but because of an incompetent or ineffective system of delivery? So 1A just expanded on Monday. As the governor said, there are certain hospital systems that are 100%. There are other hospital systems that are 20%. What's the difference between those two things? And if given to a hospital, which is a higher performer, is there a better likelihood that you can reach this 1A category before you bump them into the entire 1B category, thereby losing the priority of the 1A health status?
Next question, operator.
Next question, we have Bill Bart Jones from Newsday.
How are you, Andrew Cuomo?
Bill Bart Jones.
How are you, Bob?
Good. It looks like Long Island hit a record today for new daily confirmed cases, almost 4,000 cases. Do you have any comment, reaction to that?
Look, the facts. We tend to talk about this every day. You know the story about the frog in the pot of boiling water, Bart?
Mm-hmm.
They say, I've never tested this, frog is in a pot of water, and if you turn the temperature up slowly and you boil the water slowly, the frog will just stay in that water and boil to death. If you throw the frog in a pot of boiling water, it will jump out. But if you raise it slowly, it just sits there. We tend to talk about this every day. Take a step back. The numbers have been going up every day. We talked about holiday spread. I said it since Thanksgiving. 30 days of holiday spread. The day after Thanksgiving is Black Friday. It starts the holiday season. People are going to socialize. The numbers are going to go up. The numbers will continue to go up post-New Year's. Experts say maybe they will peak mid to late January. New fact, UK strain. All bets are off. All equations are altered. UK strain. That's where we are. And the more cases, the higher the hospitalization rate, and you're going to start to overwhelm the hospital system. That's where you are. And vaccinate the healthcare workers, because if they get sick and they don't show up, and staff shortage is already the limiting factor on hospital capacity, you're going to hit the hospital capacity like they did in California, like they did in UK, like they did in Italy, and then you're going to have to close down. Yeah. The numbers have been higher every day, plus or minus, but 4 weeks. And just factor out the line. And, yeah, I don't know what else to say. Operator, next question.
Next question, we have Jeff Cole from WWNY-TV.
Good afternoon, Governor.
How are you?
Good. How are you?
Good.
You alluded Wednesday of your optimism that New York State may see significant debt relief from the Biden administration. Does this mean that you might reconsider closing 3 state prisons, specifically the Watertown Correctional Facility? And if not, Governor, people have been critical of the timing of that announcement coming 4 days before Christmas. Do you apologize for the timing of those announcements? Thank you.
Let me ask Rob Mahika to respond to that, please.
Yeah, so the prison closures are actually related to the prison population that has declined, right, from a high of over 70,000 to now under 38,000. During this year alone, it's declined by another 10,000. So this is the lowest it has. So even after you've taken down double bunking and reduced the density, you still have overcapacity in the prison. So this reduction was actually passed in the budget that was adopted on April 1. So this was in the budget that was adopted in April 1. The plan was to do it at the end of the year. The closures do not actually take place until between now and the end of this quarter, so March 31st, and there are no layoffs associated with the closures. So there are no layoffs, so the impacts on the staff is only that they will potentially work at another facility. 100% of them will have those options. There are no layoffs, so that is the plan as I just described.
Thank you. Operator, next question.
Next question, we have Nick Reisman from Spectrum News.
Hey, Governor. Just two questions. One, should public health departments play a larger role in the distribution of the vaccine on the local level once there's a larger pool of people who can receive it? And just on the 430,000 vaccine number over the last 3 or 4 weeks or so, I understand your point that the vaccine distribution, shots in the arm, has steadily ramped up this week. But is that 430,000 number, is that acceptable to you for the first month or so that we've seen?
Well, the 430 was a ramp-up number among hospitals, right? Again, why were the hospitals the distribution system? Because they were primarily healthcare workers, and the highest predominance of them were working in hospitals. And then it became a question of the rate of administration of those hospitals. And the variance among that performance rate in hospitals, I think, surprised all health officials. But that's why the hospitals for 1A, because they were primarily healthcare workers. And you would think nurses, doctors, et cetera, they're in that facility. That would be the easiest. 1B is a totally different story, Nick. 1B, police, fire, teachers, those groups, to the extent they can self-administer, and that's what we were talking to local governments about today, that'd be great. To the extent the local health department can just give them the allocation and then they can handle it, great. 75 plus is 1.3 million people. 75 plus, 1.3 million people. The distribution mechanism there is going to be pharmacies, thousands of them across the state. Call your pharmacy, make an appointment, go. Your doctor networks, you can go to your doctor and get the vaccine. Public, local health department operations. So Albany County Health Department can provide vaccine. Federally qualified health providers, special effort community groups in public housing, churches, etc. So you're talking about a very large population in 1B, and it would be more of a private market-driven apparatus using all of the above, right? And separate from all of this, we have the nursing home operation, which is being done by federal contracts with pharmacy companies. And we have expedited that. But that should be done by the end of next week. And we've been spending a lot of time on that. But that would be great if by the end of next week we did nursing home residents and staff. That, my friend, is a great accomplishment. Then healthcare workers, so we have the hospitals working, and then 1B It's going to be very large, but the distribution network will be very large. But remember, the supply is so far behind the distribution. So let's say when we get to 1B, we open it up. Let's say it's 3 million. If we're getting 300,000, it would take 10 weeks to get through 1B, right? And we still have 1 million dosages that we need for healthcare workers. That was Melissa's point. You have 1 million healthcare workers in the state. You have 2 million healthcare workers in the state. You have 1 million who haven't had the opportunity to get a vaccine. Once you go to 1B, you make it available to 3 million more people. No prioritization, police over fire, over 75-year-olds. But that's 3 million. That's 10 weeks of supply. If you haven't gotten to the healthcare worker, by the time you open 1B, they could literally be 3 months before they get a vaccine. And if you're a nurse or a doctor, you don't want to be going into work for 3 months without a vaccine. But the local health departments will have a role in administration, especially in 1B. Now the local health departments are more working with their hospital systems because they were the primary delivery when it's 1A, and they're primarily healthcare workers. Next question, operator.
Next question, we have Matt Mulcahy from wabc-tv, Syracuse, New York.
Good afternoon, Governor. I want to talk more about President Trump, and you started your comments off talking about him today. What do you think the either legal remedies or actions that should be taken by the government in these next 13 days, whether it's the 25th Amendment or impeachment or other options to protect the safety of the American government in these next 2 weeks?
Look, I don't know that at the end of the day, 13 days, an orderly transition, the cooperation of the outgoing Trump administration. Frankly, I don't know how valuable that really is going to be. I've been involved in federal transitions. I've been involved in state transitions. If I'm the incoming Biden administration, I don't know how much I'm going to learn from the outgoing Trump administration in 13 days. I do believe a statement should be made condemning what happened. This was a failed coup. This was 4 years of appealing to fear and division and distrust. This was a clear violation of the Constitution and the orderly transition. And if I'm a cabinet member, I was a cabinet member in Bill Clinton's administration. If I'm a cabinet member in this administration, just for the history books, I step forward and say the president should be removed. If I'm Vice President Pence, just for the history books and to honor my oath, I say the president should be removed. If I'm a senator, I step forward and say for the history books, the president should be removed. For the facilitators and the enablers of this president and all those who signed on to support overturning the election, this was an affront and attack on democracy. And those Congress people who are supporters of what happened, they're supporters of a coup, as far as I'm concerned. And if I'm them, I want to clear my name for the history books. But I don't know the practical transition in terms of the new, HUD secretary being debriefed by the old HUD secretary in 13 days. I don't know that that's all that is relevant. I think this is a more profound statement of who you are and what you believe, and where were you on this pivotal issue in the history of this nation. Where were you at the Boston Tea Party? Where were you? What did you say when the mob broke through the windows? Were you with the mob or were you with democracy? Next question, operator.
Next question, we have Amanda Eisenberg from Politico.
Good afternoon,
Hello.
Governor. Can you hear me okay?
Yes.
Good. So I wanted to get back to the vaccine distribution. I'm trying to get a better understanding of what threshold you're looking to meet in order to move to 1B. I would imagine that's going to depend on different regions. And going back to some of the comments you made, about New York City, where do we go from here? At what point do you say, you know what, we need to move into 1B?
Well, let's take a number. We have 900,000 dosages for 2 million healthcare workers. We'll do an allocation this week, and then early next week we'll get an allocation. Let's say low end, 75% of healthcare workers wind up taking it, okay? If it's 75% of healthcare workers wind up taking it, you'd need 1.5 million vaccines, right? I have 900,000. You'd need another 600,000 so you knew you could reach the acceptance threshold of healthcare workers. That's about another 2-week allocation. One additional factor you have to add: how much is unused now that you could reallocate? Some hospitals have used 100%. Some have only used a fraction. How much is out there that you can reallocate? And let's say once you know you can get to about that 1.5 number for healthcare workers, which would be the acceptance rate, then you go on to 1B. Melissa's point is well taken. Any healthcare worker left behind when you open 1B, it's going to be very hard to catch up. Because 1B, you then go to 3 million people, and you're receiving 300,000 per week, okay? If the supply doesn't increase, that's 10 weeks you could be waiting in 1B, right? So that's where we are with that. Let's take one more, operator.
Last question is Robert Hackford from WGRZ News.
Hi, Governor. Can you hear me?
Yes, sir.
A quick question in regards to Erie County. We've been sitting in an orange zone for quite a while now, but based on the state's metrics, what's listed on the state website, we could potentially be a red zone at this point. Have you guys just kind of switched to focusing on the vaccine distribution, or is that a real possibility for our area? Any update you can give us?
Red zone will be when you hit hospital capacity.
Thank you.
In other words, we're looking at the hospitalization capacity increase, and when a hospital says they're within 3 weeks of reaching 85% capacity, then you would be a red zone. Hopefully, you get the rate down, and then, you can go down from an orange zone also. And Western New York was making good progress. We've had a couple of blips recently, but Western New York was making good progress. And I would like to see Western New York drop from an orange to a yellow zone. And that is also achievable if people need to do what they need to do. Any other questions? Any other comments from my team, Dr. Zucker, Beth?
Nothing
Any misstatements I made anyway? Thank you. Okay, guys, thank you very much. Thank you. Bye.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.